Dr. Bree. Today I have for you a very cool plank progression that is safe for you and perfect for you if you're just wanting to build upper body and core strength, or if you have diastasis recti, this is actually something that you can use. Now, many of you know with diastasis recti, which is the split in the muscles of the abdominal wall and the weakness of the connective tissues underneath, that planks are not necessarily a great exercise for you, because when you're in that full plank position, there's a lot of downward pressure on those very weak tissues in the anterior abdominal wall. Now, this exercise progression is safe for you if you start at the beginning and then only move on to the next step once you feel like you've mastered each step of the way. If you do have the split, then be sure to just do one step at a time until you know that you've mastered it, until you know that your muscles can be maintained in a nice inward pull throughout the duration of that particular exercise. Be very careful and definitely see a fitness professional who is trained to work with women who have this condition or men who have this condition, or see a women's health physical therapist to really get a workout that's tailored for your needs. If you're ready, let's get started. The first progression is a great way to wake up those deep core muscles. So start by stepping your left foot back, and you can stagger the feet just a little bit so your hips are square pointing forward. Really pull in your lower abs, lift your left arm up, and then hinged forward just slightly from your hips, you're going to bring the knee and arm together and apart with a lot of control. Think about exhaling and pulling your core muscles in every time you bring that arm and leg together. So again, it's the same side, arm and leg, and you're hinging forward just slightly. So we're gonna repeat the same thing on the other side. And this is something that you can do more reps of. If this is the level you're staying at for now, do more reps of this several times throughout the day. All right, other side, same thing. You are hinging forward just slightly from the hips. Again, really working on waking up those deep core muscles and integrating the breath and the movement. So you exhale every time you pull the arm and leg together. Pulling in that low belly and finishing up here. Good. Again, you can do that multiple times throughout the day if that's the phase you're staying at. If you're ready to move on, this is a move I learned from my friend Jenny Burl. She calls it the prank. It's kind of a plank, but you're at the wall. So you're up on your tiptoes and your body is in a nice diagonal line. Just hold this nice diagonal line, strong arms. It's like you're again in that plank position, but you're standing. Your body's straight like a plank from the heels to the head. Now, I like to add a little bit of a tuck with soft knees. And every time you tuck your tailbone under, you lift your belly button toward your spine, pull your pelvic floor in and up, and also your belly button and deep abs in and up, and you exhale every time you tuck. So play with this, and again, this is another move that you can do a couple of times throughout the day and do more reps than I'm showing right now. If this is the level you're staying at, plan on doing this every day, maybe even a couple of times a day, 20 reps or so. And it's a great way to still continue to wake things up and start activating and strengthening those deep core muscles. If you're ready to move on to the next progression, you're gonna need a low bench or a step stool or a squatty potty, which I'm showing here. I love my squatty potty. You can read about that in the links below this video if you'd like. But you're gonna have that low bench or step stool and you're gonna place your hands on it. Really make sure that your shoulders don't hike up toward your ears. You want to keep your neck long. Don't let that happen. Don't sink in like a turtle going into its shell. You want to keep your neck long. You also don't want your low back to arch like that. Keep your body straight like a plank from the knees to the top of the head. Nice and long and straight like a plank. Abdominals pulled in. This is a lot less downward pressure on the anterior abdominal wall than you'd have in a plain, regular, old-fashioned plank. Now, if you want to move on to the next step, you bring your forearms so that they're on the bench or the step stool, parallel to one another like railroad tracks. Again, there's slightly less downward, straight downward pull on your abdominal wall than there would be in a regular old fashioned plank. So hold this straight like a plank position, pulling your belly button to your spine. Now, if you're ready to move on to the next level, we can try some downward facing dogs, where you really think about bringing your tailbone up toward the ceiling and pulling in your low abs and lifting your pelvic floor also toward your head. So everything is really engaged through the core. Your knees can be bent, just holding that downward dog position. And you can then, the next step, if that feels like it's okay for you, bring the leg up and like a tight little ball toward your chest, staying in a downward dog position. So you're not actually shifting forward into a plank, you're staying in the downward dog position. Go ahead and switch legs. And again, staying in that nice kind of tight little ball, exhaling as you pull the knee toward the chest. So again, just like all the other progressions, you can stay with this one and do it maybe a couple of times a day, continuing to wake up and strengthen the core muscles. We are getting closer and closer toward a full plank. This is the next progression. And again, this really may not be appropriate if your diastasis recti is significant, not appropriate. I'm showing you here things you should not do. Don't let your low back arch, and don't let your shoulders hunch up toward your ears. Stay in this plank position from your knees. And after this, I'm gonna actually just show you a full plank, because maybe you're watching this and you don't have any type of condition that would make planks hard for you. Maybe you just wanted a fun plank progression. So if that's the case for you, you can move on to a forearm plank. Again, this may not be appropriate if you have diastasis recti. However, if you have really gotten to the point where you are very, very firm in those connective tissues deep in your core and your condition is almost healed, you might be ready for these next progressions, which are really full planks. So here is the official full plank. You are there. You can even do fun things such as widening your legs apart and bringing one hand toward the opposite shoulder or one hand toward the heart, trying to keep your body as still as possible as you move in this plank position. Have fun with it, and again, remember, take one step in this series at a time. Take your time and be sure not to push yourself too hard too soon. I hope you enjoyed that plank progression and can really see how each move builds to become a stronger and more challenging movement. Again, be sure to master one move before moving on to the next. If you have any questions about your personal needs, definitely talk to a fitness professional in your area who knows how to work with women's health conditions, postpartum conditions, diastasis recti, all of that. If you like these videos and if they've brought value to you, then please do me a favor and subscribe to my channel. Just hit the little subscribe button. You can also like it with a little thumbs up, share it with a friend. Just let's spread the word about feel-good fitness that is safe and effective for your core and pelvic floor. Until next time, remember, eat clean, move every day, and you will shine brighter. Thank you for watching.